Eosinophilic esophagitis, or EoE, is a chronic immunologic condition that causes inflammation of the esophagus, the tube that moves between the mouth and the stomach. EoE can cause type 1 IgE food-specific issues or type 4, which is a delayed type of allergy that can cause damage from immune cells. EoE is named after the eosinophils that are found in the area of damage in the esophagus in higher than normal numbers. Eosinophils are a type of white blood cell. They protect us from parasites and certain microbes. When inflammation from eosinophils cause damage to the body, the result is a hypersensitivity disorder. Symptoms. Symptoms of EoE in small children may be nonspecific, like food refusal, failure to thrive, failure to grow at a normal rate. Older children may experience difficulty and pain swallowing, abdominal pain, and vomiting. Teenagers and adults also have chest pain and heartburn, trouble and pain in swallowing, and sometimes choking on food. This can be really difficult, and it can cause shortness of breath, especially with dry, solid foods. It can also cause scarring and narrowing of the esophagus, further impairing the tendency for food to catch in the throat. Food can become impacted or stuck without ability to move, and this is an absolute emergency. Diagnosis. The only way to diagnose EoE is through upper endoscopy and biopsy of the esophagus. The criteria for diagnosis is 20 eosinophils per high-powered field of the microscope. Treatment. EoE cannot be outgrown. It must be managed. The cornerstone of therapy is monitoring the esophagus for damage. Decrease in damage defines therapy for success. The first part of treatment consists of defining the allergies that are precipitating EoE by environmental and food testing. Because the reaction to food is typically delayed, it's much more challenging to pinpoint. The most common food triggers for EoE are cow's milk, soy, wheat, egg, peanuts and tree nuts, and seafood like fish and shellfish. For this reason, the treating physician may opt to have a 6-food elimination diet with all of those foods, which causes a remission in nearly 90% of patients. After remission, it is possible to add back foods to test them out and help delineate ways to manage and ease those dietary restrictions. If this is too cumbersome, just eliminating cow's milk and soy, or milk, soy, and wheat may be enough to cause a remission. Unfortunately, because it's a delayed allergy, it can take weeks to months rather than hours to days to understand whether being off that food eliminates the problem. For this reason, some physicians prefer to perform a food patch test in which food is in direct contact with the skin for 48 hours. And the reaction is read at 48 hours and then a week of exposure. In young children or for patients with refractory symptoms, sometimes an elemental diet is introduced. Nutrition is entirely dependent on formula and has no full proteins, but rather amino acids, sugars, and fatty acids. All of the solid food is removed from the diet. Because it's not an appetizing diet, it may be needed to administer through a feeding tube. Some EoE is amenable to treatment with a class of drugs known as proton pump inhibitors. And this is then called proton pump inhibitor responsive EoE. This is decided if biopsy post-PPI notes a complete remission in those issues. Many people also flare seasonally, suggesting environmental allergies should be tested and treated. Once elimination of trigger foods and treatment of environmental allergies occur, the remainder of symptoms may be treated with topical steroids. These are the same, and up till recently were the same as those used by asthmatic, but rather than being inhaled, they're sucked and swallowed. Corticosteroids kill off eosinophils, eliminating the inflammation and decreasing the damage they cause. If strictures occur, it may be necessary for the patient to have esophageal dilatation performed to be able to swallow the food without choking. Thankfully, we now have dupilumab or Dupixent, which can help control the symptoms of EoE. If you need further testing or treatment, give us a call at 480-500-1902 or make an appointment online at RelieveAllergyAZ / contact us now.